Okay, ladies and gentlemen, it's now my great pleasure to introduce to you Avnish Goyal. Avnish is the Managing Director of Hallmark Health+Care, which is a very high quality service for residential care. He has 17 care homes, and Avnish has been developing the company since its inception, and he's been developing a really high level quality model of care. And I'm very pleased to say not only is he the Managing Director of Hallmark Health+Care, but he's also one of my trustees at the English Community Care Association. And Avnish does a tremendous amount, not only for his own services, but also for the sector in general. And I'm really delighted to welcome you, Avnish, and we're looking forward to hearing your presentation.
Great. Can everybody hear me? Great, thank you. Thanks, Martin, for that introduction. What I wanted to do before I start my presentation was really get a sort of sense check of the kind of people in the room. How many of you are in health and social care at the front line? So you actually are managers, owners, right? Pretty much most of you in the room. That's good. So I'm talking to the right audience here. I really want to address this morning, obviously most of you have heard Martin talk about some of the challenges that we have in health and social care. And today I want to take you on a bit of a journey with Hallmark Care Homes, my company, as to how we've addressed some of those challenges and concerns that many of us have in our sector. So what I wanted to do was, first of all, was take you into a bit of history, how we came about in our sector. And it all started in 1997. We bought our very first care home, the Hollies in Pontypridd, purpose-built care home. And very quickly we realized that our business model was about how do we deliver great care services in great environments and look after our team in what was a very nice, but definitely a first generation purpose-built care home. Very quickly we realized that the market needed more than that, and we then embarked on what was then quite an ambitious development plan, and we built 2 care homes. This is one of them. And what we would realize was that what we had to do was increase the size of our bedrooms, day spaces, our corridors, and provide a high level of care services within our home. And so we built Goodwin's Hall in Kings Lynn, right at the other end of the country. It seemed logical at the time, and then we had a bit of a challenge with our builder. He went bust, and we decided that building was not for us for a while. And for the next 5 or 6 years, we then decided to embark on buying care homes that were distressed, and there were plenty of them around, and we'd then turn the care around, invigorate the environment, and then, so we spent the next 6, 7 years doing that. And we probably bought around 20 care homes around that time and moved them forward. But more and more we were realizing that in terms of delivering high quality relationship centered care, it wasn't just about our engagement with our residents and our families, but also the design of our care homes was very important. So around 2006 we decided that it was time to come back into the designing and building our own care homes. And so we built a number of homes from 2006 onwards, but it was really the building of Kew House in Wimbledon where we really looked at some of the issues that Martin has spoken about in terms of how could we deliver on our vision with the fees that social services were paying us and our commissioners. So we embarked on a very ambitious development plan of building Kew House, which is an 81-bed care home in Wimbledon. The project cost was about £11 million in total. And it was our first attempt really at looking at the private pay market. We were looking at all the challenges and, you know, how can we deliver high quality services and be paid £400 a week? So we decided that we would go into London and we built Kew House. And we started looking at our specification. It wasn't just about wide corridors and bigger rooms, but also putting high quality therapy rooms in, high quality hairdressing salons, celebration rooms, and so on and so forth, which I'll share more with you shortly. This really then kick-started our development plan in a big way. We then went on to build 3 further homes, Alexander Grange, Wokingham, Anisha Grange in Billericay, and Bucklesham Grange and Ipswich. These 3 homes all have won the Pinders Design Award in 3 years in a row, which obviously you can imagine I'm very proud of as an organisation. And it's really the amalgamation or the coming together of a great team in terms of our innovation and design in those facilities. And the last 5 care homes that we've built have all ended up in the finals of the Pinders Design Awards. So let me show you some of the things that we are doing around delivering high quality relationship centred care and how we use our spaces within our homes to really do that. So one of the areas that we looked at was our gardens. Historically, we focused heavily on the interior of our homes. And what we were realizing more and more, and obviously working with Napa as well, was that the externals were just as important as the internals. We had to get our residents out into fresh air, doing things. So we spent quite a lot of time, and we spend a lot of money now in our gardens and our landscaping. It's very, very important. So we've done a number of projects in our homes where we've got animals in our homes, hens and doves and all sorts. And our gardening clubs that we've now formed, we have Hallmark in Bloom, but also, if you see in the bottom corner, we've got a swing in one of our gardens to actually encourage young people to be coming into our homes and obviously enjoy the environments as well. And you'll see later on some more what we've done in our gardens. But it wasn't just our gardens. We also had to up the game in terms of the facilities. How could we not just have dining rooms and lounges, but also what do residents do for the rest of the day? We've done a lot of work around our cafe areas, and all our new homes now have a large cafe area at the front of reception. These have become real hubs of our care homes, where we have a huge amount of visitors now coming to our homes, where they come and have coffee, homemade cakes and biscuits, and really enjoy life with residents. But also residents they come along and congregate to obviously enjoy the facilities as well. We've also got pubs in our new homes where residents can obviously come and enjoy a pint or a glass of wine, which has worked and proved to be popular, as well as high quality cinema rooms. These aren't just a big TV on a wall. These are proper cinema rooms with 5.1 surround sound, electronic curtains, blinds that come down automatically, and mood lighting. So it really does give you that whole cinema experience. So what we're trying to do in our homes is really create a number of experiences day in, day out. And later on in my presentation, I'll show you a video that really does capture what the still image can't. So what else did we think about as an organisation about high quality care services? It's about enablement. So in our homes, our dining areas now are continuing to evolve. We've opened up our servers so that our residents can actually help themselves to a cup of tea or coffee. They can make their own toast, they can wash up, they can cut the vegetables, they can actually get engaged as much as they wish, or they can just enjoy high quality catering service within our homes. We've also put shops in our care homes so that residents can actually come and buy a paper, they can buy toiletries, and again, those activities of daily living are obviously very much paramount in our homes. We've also experimented with resident laundries, and we've now started putting these into our homes. So residents who are able to and want to can actually come and do their own laundry. It doesn't go into the commercial laundry. They can actually see their washing being washed in front of them and can be assisted or do as much as they can. And these are also proven to be very popular. Another idea that we had, and we worked with Napa, we've been developing our relationship-centered care strategy for a while now, and we went to Napa. How many of you deal with Napa or know the organisation? Show of hands. A few of you. I really urge you to look it up on the internet and get engaged with Napa. There's a lady who runs that organisation called Sylvie Silver, and she's very inspirational, and she's been working with us for a number of years now in terms of supporting us in continuing to evolve our care services. And we did a project on relationship-centered care because I went to Sylvia and I said, we really want to deliver high-quality relationship-centered care. Tell us an organisation that's done it before and we just want to replicate them. And she said, there isn't one. We're going to have to work